unknowingly being asymptomatic or symptomatic has infected all of the family members. Secondly, the phenomena last year what was seen was it affected mostly the elderly population and people with comorbid conditions. But this year it infected almost all age groups, all strata within the family. Thirdly, last year it didn't affect the children, the young population. But this year we saw everyone getting infected, even the children presented with clinical presentations. Over the last few days, we have seen some deaths among the children also. Unfortunately, the trend is there that children are getting infected and newborns are getting succumb to the infections. And another thing, what is happening with this year with the children is that those children who have got infection within the family and had remained asymptomatic present later within 2 to 4 weeks of the infection with involvement of multiple systems in the body, and that is called as MISC, multi-system inflammatory syndrome in children, whereas they see many systems getting involved and they present with varied symptoms in the hospitals, though majority, almost every one of them do recover, but still they get some sequelae because of the COVID infection. So over these years, we see everyone is getting infected. We see everyone is getting infected, and uh, there is restraints by the government. Many a times, the efforts put in by the government are more of an administrative than a technical things like putting a lockdown, putting strict lockdowns. So that has helped to uh, prevent overwhelming of hospitals, because once we look at our own health setup, we have a limited healthcare system available. And once we look into the globally into the Western countries which have advanced healthcare system, even they got overwhelmed and they couldn't afford to have managing all the cases who come to them, and many of the systems collapsed. We saw same picture happening over last 2 months in most of the cities, metropolitan cities in the country, especially in Delhi and Mumbai. But fortunately, the case scenario in our setup in Kashmir, I would say, particularly, we didn't saw that much that we had to have overwhelmed our health system, though it was to the full of its capacity. But because of the lockdown, the transmission was halted to some degree, and the number of cases started at a plateau. And over last couple of weeks, I would say there have been some decrease in the number of cases coming up to the hospitals. But unfortunately, the number of deaths is still same as we saw, because what we are seeing in with regard to mortality, that many people who get infected do get severe conditions a few weeks later after getting infected. So those people who have got infected in a month's time or 2 or 3 weeks are now succumbing to the disease. So we still have time to think over about our strategy, whether we should continue with the lockdown, or some people say some smart lockdown, or nowadays government is coming up with, in especially in J&K, with a new strategy of vaccinating the high risk population. You might have seen people from different walks of life, like shopkeepers, laborers, and from transport sector, tourism sector, and employees are getting preferential vaccination. With regard to vaccination, we would say that last year we were all hoping that we should get some vaccine, a panacea that would prevent it. And at the end of the last year, vaccines were rolled out, and in the country itself, in the mid January, the healthcare providers were provided vaccines. Then later on, the frontline workers, and from 1st March, the elderly population above 60 years and people with comorbid above 45 years. And from 1st April itself, all people above 18 years were asked to go for vaccination. And there were two different types of vaccines which are manufactured in the country. The number one, the Covishield, which is basically a Oxford AstraZeneca product, licensed product from them, which is being manufactured in India by Serum Institute of India, and that was given initially among the population of 45 to and above years. But over last couple of weeks, we saw that above 18 people in the preferential high risk group are also receiving the same vaccine. And the second vaccine, which was manufactured in the country itself by Bharat Biotech in collaboration with Indian Council of Medical Research, and that is Covaxin, is a killed vaccine, and that is being given to children or to adults, I would say, above 18 years. But unfortunately, some rumors were spread based on some observations made by a French scientist that it may cause the mutations may be caused by the vaccine, and that may cause more cases later on. And he's talked about antibody dependent enhancement. That means the vaccine may enhance entry of the viruses. The antibodies developed by the vaccines may facilitate entry of the virus, and that may flare up the disease. But all these things have been refuted by the scientists globally. And while developing the vaccines, all these things are considered. And with COVID vaccination, no such phenomena has been observed globally. But now we are seeing more and more people going for vaccination. And globally, if we look, over 210 crore vaccine doses have been given till date. And while in India, over 22 crore vaccines have been given, and around 16% of population has been covered. Looking at the huge quantum of population within the country, it's not it's a small task, but it's a big mammoth task to vaccinate whole population, and it may take years. And but the trend of vaccination has quite gone up, and daily around 25 lakh doses are given in India. While in J&K, we have seen over 28 lakh doses have been given as a first dose in J&K, and over 5.6 lakh doses as second dose, and around 34 lakh doses of COVID vaccination has been given in J&K itself. So over the months, we may feel that more and more people would come and would take vaccination, and that is the only thing that can protect us from the third wave, which is anticipated. If we look at the first wave, it has a slow rise, and there was a peak, and there was a small plateau, and there was a steady decline. So it extended over few months. I would say for 4 to 6 months, there was the first wave, but then there was a drop, and then later on, by October, November, December, and Jan, we didn't had any cases, and people forgot that there is no COVID, and whatever COVID appropriate behavior they were following, they just lowered the guard, and people were not using mask, and person who was walking with a mask was looked at differently. Was given name that he's very afraid of the disease, as well as over 95% people were not taking masks. And during that period, more and more people start getting infected, and the virus mutants which were circulating in the community got transmitted to the population. And now thereafter, we saw the second wave, which was of a short duration with a spike in just few days, only couple of weeks. We saw cases rising up, and in just 1 month, we saw the sharp rise in the number of cases. And as it was learned that the two strains which we had with the with these which are circulated in the country, and especially once we look at the strains circulating in J&K also. So we had the UK strain that was B1.1.7 nowadays, called as alpha strain, and secondly, which has affected around 16.6% of our population. And secondly, the more deadlier one, which was spreading quite fast, now called as the Indian double mutant strain, but the name has been changed by the WHO recently, and nowadays it's called as the Delta variant, which was previously called as B1.617.2. So these two strains, once we look at both the strains, around 29% of all the strains which have been isolated among the population in J&K were because of these two strains. And these two strains are being seen globally as variants of big concern, because once in India, most of the cases have occurred because of these two strains. And nowadays, the countries which have even covered COVID efficiently are under threat because of these two strains, especially the Indian double mutant strain. So for us, what we talked about COVID appropriate behavior. So we had last year the three main things, that is putting up the mask, secondly maintaining a social distancing at least of 2 meters apart, thirdly hand hygiene and cough etiquettes, and now this year we had the fourth cornerstone, that is the vaccination. So if we follow the responsibilities as a good citizen of maintaining social distancing, especially in where we have social gatherings like this. The marriage season is coming up in Kashmir, and people are forgetting about these behavioral changes. And once the function is over, people start coming up with symptoms, and we have cohorting of cases coming up from within those people who have had got affected because of uh, having staying together and living together during those times. And we see many people coming up with those symptoms. So in those social gatherings and family gatherings, and they died because of the complications of COVID, because it's a multi-system involvement disease, and that's why we see more and more people getting serious conditions. Involvement of lung is more, and there occurs fibrosis, and there occurs inflammatory changes. Cytokine storm is there. So a lot of things are happening, and unfortunately, what we saw again this year was more young people are dying than what we saw last year. So we need to have maintain those COVID appropriate behaviors. Regarding use of mask, we see people are using mask as a punitive action. They only put on a mask when they see some policeman on the road is just watching. Or we need to wear mask as if we are wearing other apparels. So if we are putting up a shirt, mask is just should be part of our clothing, and we need to have mask hygiene. Again, we need to consider mask hygiene important. So what we are seeing, that people move out in the morning putting up mask which was kept dangling somewhere, and it's all exposed to the environmental uh, exposure, dust, fumes, even the moisture, and they put in the mask, and that causes more concern to the people who wear the mask, because it may have ingrown microbes, and that can lead to more infections. So mask hygiene is very important. If we are using the cloth mask, once we come back from our office hours or like that, once we reach back, we should ask someone in the family or do it ourselves. We should wash the mask with detergent or soap, and then dry it and iron it. And we should replace mask every time. So we should not use the same mask every time. And people who are using the triple layer mask or some other mask during the day, while exhaling, a lot of moisture is getting captured in that, and it can have it can get become a suitable place for microbes to grow on it. And nowadays we see the disease conditions like mucormycosis is a fungal infection that affects the mucous region of the nasal cavity, mouth, and unfortunately it can get extended up to the eyes and the brain also. And we have seen people who are having diabetes and are on oxygen inhalation and have been on steroid treatment. These people are at high risk. So for them, again, we need to have better care during such treatment. So during these times, we need to have follow the hygiene by much better way, be more pragmatic about use of masks, maintaining social distancing, hand hygiene. And another thing within the families, what we have seen, that we feel that someone in the family is immune to COVID, and that's why if we get a guest or some friend into the family, we don't follow the COVID appropriate behavior. We feel that these people are not the ones who could transmit disease, but unfortunately, these are the ones who bring the virus to the family, and get in a whole family infected. So once you get any guest into the family, be it a friend or a relative or some person or some helper working in the family, we need to follow the COVID appropriate behavior within the families also. Then regarding vaccination, there have been some concerns within the community, especially among the youth, that these vaccinations may cause infertility or sterility. That's why we see less participation among the female folks, more so. And I would like to emphasize here that similar things have happened once pulse polio vaccination was carried out in the country. Once we look back in 1995, when the first vaccination of pulse polio was given throughout the country on the same day, on 5th of December, there were some reluctance in the community, especially among the Muslims in the UP area. And we saw Muradabad, one of the bigger districts in the country, had maximum number of cases of polio, and that was called as the polio capital of the world. But because of the influences made by the authorities, especially UNICEF and WHO and the government of India, and the local involvement of the local preachers who were made to understand the importance of vaccination and its benefits over its risks. Just over a decade, the Muradabad was polio free. So same thing, that the things about causing sterility and infertility was thought that time also, was ingrained among the minds of the people that time also. But if we look now, had it been the situation that time, now there wouldn't have been a population this time, because if all those children who got vaccinated and might have got sterility, they wouldn't have married and had children this time. So as on date, same things are being circulated in the media, that it may cause sterility and infertility. Let them be assured that it doesn't cause any such disease, and getting oneself vaccinated is of much more importance and beneficence than getting thoughts about some distant or remotest situation. So my request to the audience here, to the participants here who are over 100 this time, that if you have not got vaccinated yet, please come to the nearest health facility. If you are above 45, you can go for a walk-in Covishield vaccination. If you are among the high-risk population, among the 18 to 45, you can again go to the designated sites for Covishield. If you are a student or a low risk, then you can log in with the CoWIN app, cowin.gov.in, and just fix a schedule with you for dose 1 of Covaxin, and you can get the second jab after 4 to 6 weeks of the Covaxin. And those who have received Covishield, their second dose is around 12 weeks to 16 weeks after you get the first shot. So my earnest request this time in this webinar is that those among you who have not taken vaccine, and among within your families who are still reluctant to take vaccine, please go for vaccination, and it's this vaccine which will save us. And if you look back to the countries where the developed countries who have taken vaccines, they have just taken off their masks. There have been guidelines by CDC, Atlanta, USA, that they don't need to take masks in USA. If you look at the countries where we had maximum vaccination coverage, for example, Israel, again, they are back to the normal pre-COVID times. So if we are looking to have come back and go back to the pre-COVID times, then we need to follow the COVID appropriate behavior and should go for complete vaccination. And that is something which will save us and save our future generations also. Should I continue, or there are some queries?
There are a few queries. I'll read out the first query to you. That one is that if the coronavirus, when we know that COVID is an RNA virus which mutates very rapidly, then how is the vaccine useful in lowering down the mortality rate?
Research is being carried out globally across the globe, and there have been some publications in the top reputed journals, especially Lancet. where they have found that vaccination has been effective against the two main circulating strains, both now the Alpha and the Delta strains, the UK variant and the Indian mutant variant. Around 60% protection is still being provided by the vaccines which are being given. If we look at the vaccine, the Covishield vaccine is a vector vaccine, while as the Covaxin is a whole cell killed vaccine. So the vaccine which has been produced will develop antibodies against the whole component of the virus. So even if there is some mutation at some level within the RNA, it will definitely provide protection against the all other types of mutants. It's not that it will provide 100%. No vaccine is 100% effective. If we look at the influenza vaccine, over the last few years, we have seen influenza coming up during winters, and many deaths have occurred in our part also. And we have seen there is a surge of influenza vaccination among the population, especially among the elderly. But still, that vaccination doesn't give 100% protection. And that's why every year you see new vaccine formulation. And same way with COVID, presently the available vaccines what we are having does provide protection against the vaccine, against the viruses, the strains of the viruses and the mutants which are circulating. With regard to the mortality, if we look back into the number of deaths we have seen over these weeks, once vaccination was started, the percentage of deaths among those who are vaccinated is just around 10% who have received one dose, because they have not received second dose yet. So 90% of deaths what we have seen in, I would say in Kashmir or Srinagar itself, 90% of the deaths haven't, for people who have died, haven't received any vaccine. So that is an indication towards that people should go for vaccination, and it definitely protects against the mortality. With regard to morbidity, the severity of the disease, we have many doctors who vouch that once they received the vaccine and they got infected, either the course of illness was mild or the severity wasn't that much and the duration was also shortened. Very rarely the people who got both the doses of vaccine had any serious consequences. So this is again a positive thing to go for vaccination.
The second question is, what exactly is causing this mucormycosis, and what should be the right behavior to avoid it?
As I said, mucormycosis has been seen or set up even before COVID. There are people who are having decreased immunity, and that's why the common cell, whatever, be it bacteria, fungi, or even viruses, they become an opportunistic infection for them. And in the current scenario, we have seen cases who are diabetic, uncontrolled diabetes, because of high sugar. They always have a risk of getting infected. And once they are on high sugar and are on treatment for COVID, especially with the corticosteroids, and they are on oxygen inhalation, especially when they are on people on oxygen, to have co-administration of corticosteroids, and all the three things add up to get, because COVID per se also decrease the immunity, and all these things add up to favor invasion by the common cells and opportunistic infection. And mucormycosis is a situation where fungi gets, which is already present in our environment, and many a times we must be inhaling these fungi, and they get an opportunity to get to invade the mucosa, and that's why it spreads very rapidly in the nasal cavity, then moves up into the affects the palate, moves into the nasal cavity, reaches the orbits, and sometimes brain. And even as on date, we have even a case with us in one of in hospitals, where a case of mucormycosis who doesn't have underlying COVID or underlying some conditions. So it's not that with COVID we will always have mucormycosis. So a personal hygiene, a better immune system within the body are things what are required to prevent such type of fungal infections and sporadic infections.
Question is basically, I would like to add to that third question. It is, Assalamu alaikum. My parents are not allowing their children, so how can we make them aware about the importance of vaccination? I like to, before you answer this question, I like to add something to it, that COVID becomes a reality when you lose a loved one to it. I mean, I have lost somebody very close. We are very well aware that we lost a very close part of my life to COVID. So people realize the seriousness and of COVID and importance of COVID only when we lose someone, or our dear one is admitted in the hospital for months together. Then we get to realize what COVID is. Sir, I'd like to you to add to it that how can the students, particularly the students who are present here in this online series, how can they make their parents realize that COVID is, I mean, really something that can take away lives, and they can make them realize the importance of vaccination?
Definitely, you are all science students and you have the background of biology with you, and you can just influence your parents about the advantages of vaccination, how vaccines develop immune response within the body, and how these antibodies protect against various infections, including the COVID. And in absence of that immune response, how much vulnerable we are to these infections. And God forbid, in a situation where a person who is not immune, if a person gets COVID, how deleterious effects it had with regard to morbidity and mortality. So these things, and you may have examples within the families itself who have received vaccines and they have got infection and their course of illness is very mild, while as there may be many among your family or neighborhood or in your acquaintances who might have got infected and might have landed in the hospitals because of COVID or its complications. And these things, so we need to bring about behavioral changes within our families itself. We need to influence our near and dear ones, especially our parents, who are reluctant to go for vaccination. And my earnest request to all of you that if you have parents who are now in 50s or 60s, please ask them to go for vaccination, because once we look at the other epidemic of non-communicable diseases, I would say around 30% of our population in Srinagar are hypertensive. Every third person in Srinagar among the adults is a hypertensive. 10% of our adolescents are hypertensive. 10% of our adolescents are in a pre-hypertensive state. So with regard to the diabetes, 10% of our Srinagar population among the adults is diabetic. 10% of our children are in the pre-diabetic state. So we are in a population which is more vulnerable to the severe effects of COVID. So we need to protect our vulnerable population. And once we look at the elderly population, the prevalence of diabetes and hypertension is quite high among them. So they are more vulnerable. Their immune system is already a bit compromised with regard to non-communicable disease and lifestyle diseases. So the consequences of getting a COVID infection among them is more deleterious. So we need to influence such parents and people around to go for vaccination. There is a question. Hello. If I am having cough, cold, should I go for vaccination? There are no contraindications to go for vaccination unless you have a serious health conditions, disease presenting in acute conditions or having high fever. Other than that, there is no contraindication to go for vaccination. Can adult take this vaccine? All above 18 people shall go for vaccination, and in West presently some research has been carried out and they are going for vaccination among the children also. So maybe Government of India will start vaccination in coming months for children also. And it has already allowed the lactating mothers to go for vaccination. But with regard to pregnant women, they have not come up with the guidelines still.
So there is one question which says that is it necessary to conduct the test of COVID before vaccination? Because most of the people have, like, also for the people who have tested positive for COVID, and how long do they need to wait before vaccination?
Any person who has tested positive for COVID, the current guidelines is that they should go for vaccination 3 months later, 12 weeks later after the infection, because that infection has already elicited an immune response within them, and they had developed antibodies, and this vaccination will help and boost their immune system. So they should allow 12 weeks after getting becoming positive to get the first jab of vaccine, and then thereafter again 3 months later go for a second dose of vaccine.
I think we will be doing with these questions only because we will be connecting to you again very soon with regard to the part second of COVID-19 pandemic for our students, because we need to make people very much aware about whatever we talked about today, whatever we deliberated on today. This has to be elaborated for our faculty as well as students, and we'll keep the link open for all other participants from other colleges as well, so that we stay aware and we stay together in this. I would pass on the session proceedings to Dr. Gohar to formally thank you for this very, very, very important lecture.
I would like to respond to a few queries, because is this a rumor or truth that by doing vaccination there are more chances? I already refuted it that there is no chances of getting death among the elderly population. So please ask them to go for vaccine. They are at high risk of getting infection. If there is no symptom of COVID, then should we go for vaccination? Everyone who is eligible for vaccination should go for vaccination. They should not go for any test. Please go for vaccination. The medical waste, like these things, are being disposed of openly. That's very unfortunately, especially in people who are positive in their homes. They should dispose of the waste from their homes in a scientific way. They should disinfect the waste by using disinfectants. If you have sodium hypochlorite or some other disinfectant, please use that before disposing of into the municipal waste. And why people get COVID positive even after getting first dose of vaccination? It's an important question. I would like to end up with this. Once we get a vaccine, it takes 2 to 3 weeks to develop antibodies. And during that period, we are at equal risk of getting an infection and developing a disease. So it's not that people who get a jab today and will feel that they are protected. It takes time up to at least 2 to 3 weeks to develop antibodies. And a person who is immunized is always at risk of getting the infection. Vaccination doesn't prevent infection, but vaccination helps in developing antibodies to protect against that infection. So people who are vaccinated, even if they get infected, the antibodies developed by the vaccine doesn't allow that disease to become severe or serious and prolonged. So people who are vaccinated, even if they get infected, the course of illness is very mild. That's why we see that there are no deaths among people who are fully vaccinated. Almost no deaths among people who are vaccinated. Thank you.
I think we are done with the questions. So thank you, Dr. Salim sir, for a wonderful talk. I hope the students might have benefited from this beautiful talk, how you have explained that virus is mutating itself in the environment. So we need to follow the COVID appropriate behavior, and how the vaccination is important for all of us. So I will pass on the session to Dr. Munisa Aslam for formal vote of thanks to the guest invited speaker.
Thank you, sir. It was very informative and innovative talk, and we hope that all the students and faculty members would have got enlightened by this talk. On behalf of the organizers of this week-long program on World Environment Celebrations, especially the principal SP College, who is also the patron of this program, I thank you for joining with us and deliberating the talk on COVID pandemic. Where are we going? Basically, this is the need of hour to get sensitized on the prevailing COVID-19 situation so that proper management strategies are achieved and planned accordingly. Thank you once again, sir, for joining with us. Thanks are also extended to all the participants who joined this meeting, and hopefully they have also gained awareness and knowledge about the topic delivered by our worthy guest speaker.
Thank you very much for inviting me, and have a nice time. Thank you.
Thank you, sir. Thanks are also due to all those who extended their help in conducting the said program. The organizers are especially very thankful to the technical team who provided with necessary IT support to this event. I also thank coordinators and in charge of this session for providing me an opportunity to present vote of thanks and hope in near future we may be able to conduct these programs physically. Thanks one and all.
Thank you.